Hi, good afternoon. Welcome to Grand Rounds. The topic for today is GrandPads Telehealth and the PACE program. Next slide. Let's go through the meeting logistics. All attendees are muted in this environment. Please use the Q&A box to ask questions and share comments throughout the presentation. This presentation is being recorded and will be posted on the Caregiver Grand Rounds site as well as previous Grand Rounds. Next slide. There is CME information. Please note you can log into your CME portals with Swedish Medical Center and Issaquah, and as well as nurse application for nursing CEUs. Next slide. And our planners and presenters do not have a financial relationship with commercial interests. And the learning objectives are: number one, define what clients would be eligible for PACE, identify 3 types of encounters that are appropriate for telehealth, and identify 3 benefits of telehealth for older adults. Next slide. And our 3 speakers are, first is Susan Disman, who grew up in the Chicago area and obtained her Bachelor of Sciences in recreation therapy and is a certified therapeutic recreation specialist. She joined Providence Elder Place in 2006. Initially, there was 240 participants, and now there's more than 1,000. The second speaker is Dominic Cardelli, who obtained his Bachelor of Sciences in Recreation Therapy and Psychology from Central Michigan University. He also works with Elder Place. And our third presenter is BreAnna, who is the account manager for the program. And now I'll turn over for the reflection.
Well, thanks for joining, everybody. This reflection is part of a kudos board that we had sent the person who gave us our original donation to obtain our first GrandPads. And we just wanted to read off some of the comments that people had added to that GrandPad. The first comment is from one of our chaplains. And she said, one participant who has struggles intensely with isolation is thrilled every time we get to meet face to face with her GrandPad. It keeps her connected. We talk and pray. And she also loves that she can see my cat virtually while I'm working from home. When this participant developed COVID and was isolated, scared, and ill, she told me repeatedly that being able to talk to her family and caregivers on the GrandPad was her lifeline. She's doing great now, and both she and I are incredibly thankful that we can keep meeting via GrandPad.
And the second one is from one of our physical therapists. And she wrote, our participants are so happy to be able to have the GrandPad to join exercises, trivia, and seeing their friends during Zoom classes. The easy access to contacting their healthcare team members made them feel supported and not alone. It lifted their spirits tremendously, especially those participants who needed to quarantine in their rooms. Some of them were using their phones, but it was hard for them because they cannot see the small screen well. Being able to get into touch regularly with their families and even just playing games on it helped them bear this pandemic and will continue to do so with the help of the whole team. We thank you for these awesome gifts, and I'm sure our participants would want to thank you personally if they could.
And this comment is from one of our participants named Kathy. And she said, I completely love the GrandPad. I don't know what I would do without it. I get to see my family, and there would just be no other way to do that. It's just wonderful. I love this machine. Especially during Christmas, I was able to see my family and we shared our presents together. I loved it. It was like a birthday and Christmas present all together. On my birthday, the GrandPads staff called and sang me a song for my birthday. It was so special. During this pandemic, if I didn't have the GrandPad, I would feel so alone. I am very thankful for the GrandPad staff and for our generous donor.
And the last one is from another participant, Marcia. She wrote, the GrandPad is wonderful. We had a power outage for 8 hours in my building, and I really needed a flashlight option. I did not have a TV or a phone, but the GrandPad still worked. I've also used the calculator many times. That last one, I think, just shows how, our participants are able to use it for a number of different things and in different situations too. So it was a unique one.
All right. Next slide, please. So today we're talking about GrandPads, telehealth, and the PACE program. Next slide. So before we get really started on the GrandPads and telehealth, I just wanted to let everybody know a little bit about what the PACE program is all about. So PACE stands for Program of All-Inclusive Care for the Elderly, and it's a model of care designed to keep older adults as healthy as possible and to remain as independent as possible living in their own communities. The PACE model of care is centered on the belief that it's better for the well-being of older adults with chronic care needs to be served in their own communities whenever possible. So the PACE program is really kind of two programs rolled into one. On the one hand, we are a health plan, like a HMO insurance company, and we manage the Medicare and Medicaid benefits of our participants. And then on the other hand, we're the medical providers. And at each of our centers, we have our full medical clinics and rehab gyms and our adult day health programs. If you wanted to join the PACE program, you have to be at least 55 years old, and you have to live in the catchment area of the PACE program that you want to join. And you have to be eligible for the Medicaid Chore Service. In Washington State, that's called COPS. And then when you join the PACE program, you get a tremendous array of services. The PACE program delivers all needed medical and supportive services for the entire continuum of care. So we provide primary and specialty medical care. We cover mental health services. We cover hospital care and nursing home care if necessary. We administer the Medicare Part D benefits, so we cover all the necessary prescriptions and over-the-counter medications. We provide and cover lab tests and diagnostics. We cover medical supplies. We cover durable medical equipment. We cover nutrition supplements. We cover dental, hearing, vision, foot care. We have nursing services. We have therapy services. We have social work services. We have rehabilitation services. We have our adult day health program with social and therapeutic activities, and usually lunch, depending, on the COVID numbers. If a participant lives in an adult family home, or some states call it a group home, or if they live in an assisted living facility, we cover that. We cover all spiritual care services. We have home care services. We have home health services. And a really great benefit is that we provide all medical transportation, so our participants don't have to worry about getting to an appointment. And our schedulers are always calling participants to remind them about their appointments and mailing reminder notices. So our participants, and really our staff too, kind of call it one-stop shopping. So they can get all of their coordinated services in one spot. So that's a little bit about the PACE program. Next slide, please.
So when we started the GrandPad program back in late March, early April of 2020 for both Washington and Oregon. For Washington, we were able to secure 100 devices initially by a generous donation. And Oregon was able to secure 25 devices through a state grant. With these, in the very beginning, with the limited amount of devices we had a specific criteria to identify which participants were at high need for the device. The first criteria was participants who lived independently and did not have access already to a smartphone or tablet with Zoom capability. The second criteria were participants who were at high risk of hospitalization or emergency department visits. The third were participants who are teams identified as closely monitoring for acute health or social needs. And lastly, were participants without access or funds for reliable internet service. Next slide.
Great, thank you. So at GrandPad, we always start all of our meetings out with our mission. So our mission is to improve the lives of millions of seniors by reconnecting them with family, friends, and as you can see here today, caregivers. GrandPad as an organization is about 8 years old. We've supported over the 8 years 1.3 million GrandPad users, and we serve friends and family in over 120 countries. The GrandPad also supports about 39 languages, and that is growing monthly. So that's super exciting for our growth to support our bilingual users. Everything on the GrandPad is HIPAA compliant, from the platforms that our care teams use to connect with their participants all meet HIPAA standards. We will be getting our high trust certification here in the next couple of months. If any of you are familiar with that, that is a lengthy process, but that should be closing soon. The GrandPad is what we consider to be a circle of trust. And so the GrandPad, if family and friends aren't listed in our system, or if a care provider isn't listed in our system, the call or the email will not go through to the GrandPad. It's kind of stopped at our front door, if you will. So no spam calls, telemarketer calls, none of that will be able to go through to the participant, because as we all know, the fraudulent activity that is targeted to seniors is excruciating. And so we block that out through our systems here. Through our business to business side, we currently have about 92 business partners that we work with. PACE is a very large partner of ours. We are going up to about 40 PACE partners within our partnership relationships. So our business model and use case differs from partner to partner. Example being PACE, they use what we call a one-to-one model with their GrandPad. So each participant gets their own device, and then care providers call and reach out to them directly. They have the GrandPad for an extended period of time. Say they pass away or leave the program, the device then gets cleared and reassigned to another participant. We have partners who also use what we consider to be a shared device model. And we had some really interesting use cases when COVID first took off, as people were kind of coming to us with their hair on fire, trying to figure out how to continue care with their patients. We had one model of care where a provider was in the clinic with a GrandPad, a car would pull up, a CNA would hand the person in the car a GrandPad, they would conduct a telephone visit or a telehealth visit, that person would drive away, and then the next car would come up. So that was one model with the shared device. We also have quite a few relationships where home health care goes out to see a patient in their home. They take a GrandPad with them, and while they're at their home visit, they also connect that patient to their provider back at the hospital and conduct a telehealth visit that way. And then they disinfect the device, go to the next home, and that continues to be their model of care. We have one partner coming on right now that uses their GrandPad in isolation units, and so they actually rigged the GrandPad up and mounted it to an IV pole. So the GrandPad is stationed in front of the patient, and then they have loved ones in kind of a family room waiting area, and they connect the GrandPads together so they can see each other via Zoom. What we are very passionate about here at GrandPad is our customer service. And so we have agents available here 365 days a year, 24 hours a day. And so whether Susan or Dominic call in with a question or a participant calls in, it's a real live person. They don't have one for billing, two for customer service. It's an agent that's trained across all platforms and is able to assist anyone with their questions. So we know telehealth overall has grown since 2020. It's about 38% higher usage than before COVID-19, and 13 to 17% of all specialties in hospitals continue to use telehealth now. Patient and physician attitudes towards telehealth has also improved. About 40% surveyed on CMS report that they'll continue to using telehealth after the COVID-19 pandemic slows. So that's up from about 17% higher than pre-COVID when it comes to evaluating people's use of telehealth. And so, GrandPad, granted, we grew very, very quickly during 2020, but we're not slowing down. We continue to have more growth opportunities and different use cases that present to us. And we love to hear those. We love to work with different organizations and meet their needs. So thanks for having us. You can go to the next slide. So this is Providence, Oregon, and Washington's overall participant engagement. So this is both of the organizations looped together. So I'll just call out a couple of these numbers. So total throughout the year last year of 2021, they had 255 devices delivered and assigned to participants. And so if you look at the top right corner, the concierge calls. So every GrandPad, the very first button on the GrandPad is what we call a concierge button. And that is how the participants reach the centers, the offices. So they hit the concierge button and then they're connected to their care team. And so they use that button 3,354 times. So granted, that might be just calling to check an appointment time. They might be calling because they need medical assistance. Those calls vary, but it's nice that they have access to the centers at any time that they need it. The total clicks and hours of use, their participants are very, very much engaged, and that's full credit to people like Susan and Dominic that have wonderful programs going on the GrandPad to keep their participants engaged. But what we like to focus on here is the video chats and Zoom calls. So 1,299 times staff members have called out to a participant for a Zoom call, for a video call. So this allows the caregivers to get eyes on a participant. They can assess, are they out of bed? Did they shower today? Are they dressed? How's their mental health doing? How are they looking? Are they dehydrated? You can get a lot of assessment in just by putting eyes on a participant, and they've been doing a great job with that. And then Zoom calls, 9,110 Zoom calls that they've hosted. And those are just an array of activities that I'm sure Dominic and Susan can speak more to. Anything from chaplains, bingo, exercise groups, the opportunities there are endless. So they've taken full advantage of the GrandPads and their PACE centers.
Next slide, please. So we just wanted to go over briefly the differences between how we set up our programs in Oregon and Washington. But even though we have some differences in how the programs were set up, we're still seeing the same benefits. The benefits we're seeing in Washington are really the same benefits that they're seeing down in Oregon. We started off with a different number of GrandPads. Like Dominic said, Washington had 100. Oregon had 25, and we're going to end with a different amount. Oregon will have all of their GrandPads deployed, I think, by the end of the second quarter, and we will have all of our GrandPads deployed in Washington by the end of the year. Washington will have 800 GrandPads, and Oregon will have 250 GrandPads. Our GrandPad committees were set up differently. In Oregon, it was mainly the life enrichment coordinators and the center managers. In Washington, we only had one manager on our committee, and the rest of the committee was made up of various disciplines and representatives from all of our different IDTs. The GrandPad calendar we're using a little bit differently. I know down in Oregon, they put all of the Zoom activities that they offer on the GrandPad calendar. We're only putting on therapeutic activities, therapeutic groups, and we're using the calendar a lot for appointment reminders. So those are some of the differences. But then, as you'll see, we have really ended up with the same benefits. Next slide.
So with this change, we wanted to ensure that we're engaging our staff so that we utilize these devices we have. And by doing this, we first simply talked about the GrandPad amongst our teams. And we did this through our monthly all staff meetings. We would have updates in our weekly interdisciplinary teams. We would talk about who's appropriate for the GrandPad. And also we would have training sessions with the disciplines on working how to best utilize the GrandPad. We also created a GrandPad demo for each of the 6 sites in Washington. And this allows caregivers, staff to see the actual physical device so that they're better able to help participants if they have a question. And we're also able to show the demo device to potential participants to see if they would enjoy or benefit from the device. We also created, as talked about, a committee. So we call it the GrandPad Champions. Here in Washington, it's made up of different members from each of our sites. And we meet monthly to work on workflows and also the delivery process. And lastly, we've started caregiver engagement incentive plans. Most recently, we started one coinciding with this year's Winter Olympics, kind of called the GrandPad Olympics. And it was just a fun, friendly way for us to incentivize our staff to keep utilizing the GrandPad in contacting our participants. Next slide. So there's many uses of the GrandPad, and we sort of split it up between 2 domains, medical and social. So on the medical side, we have therapeutic groups, Zoom groups, and these can be physical or psychosocial therapeutic groups, either on our calendar or even more specifically, we've created specific therapeutic groups for smaller group sizes. Our providers are also able to contact individual GrandPads for a one-on-one telehealth appointment. We have participants who have used the GrandPad to access their NA and AA meetings. We also have the ability for the GrandPad to be used for internal and external counseling appointments, as well as we're able to use the Zoom function for outside specialty appointments as well for telehealth. And lastly, we utilize the calendar it could be from medication reminders to appointment reminders and to simple check-ins as well. On the social side, we're able to add a family administrator for the GrandPad. So this would be a family or friend that the participant designates. And this person is able to add contacts, upload photos, and send messages to the participant to keep in contact. There's also a plethora of games included in the GrandPad. And GrandPad also created an interactive game competition through their email chain to also get more engagement from participants if they want to have a high score in bingo. There's also music and radio abilities. There's a large music library. We also have the ability to add different radio stations to the device. So it could be local or from their original hometown. There's also what's called the Moods app, which is auditory and visual stimulation through video and sound. So you could have a fireplace going in the background, or if the participant is missing some nature, there's also videos of spring, fall, winter. We also have daily articles that are updated often through the GrandPad, and participants are able to sort of customize by favoriting their articles, and so that they can go back and read more. And lastly, we've created a system for our volunteers to be able to call these GrandPad devices for a virtual one-on-one chat with a volunteer. Next slide.
So we've seen so many benefits of the GrandPad use. First of all, of course, is what we've been saying so far is that we've been able to see some decrease in isolation and loneliness and increased socialization for our participants to their family and friends. Our participants can call their families can call them as a video call so they can actually see each other. Our participants, when they've made friends at the center and they know someone else who has a GrandPad, they can call the GrandPad company, and so they can do GrandPad to GrandPad phone calls so they can talk to their friends. So it's really been able to increase the socialization. And also we've been able to see an increased connectedness to the IDT. So our participants before COVID, some of our participants would only come to the center once or twice a year. But a lot of our participants would come for the adult day program. So they were coming to the center one time or 5 times a week. And so they just by coming to the center, they would see, their doctor, they would see the social worker. They wouldn't necessarily have an appointment with them every time, but they would be just seeing them. And when COVID hit, and we had to close down some of our centers. And then when we reopened, we couldn't bring in as many people as we had in the past. That connectedness to the ITT really sunk. But with the benefit of the GrandPads, we've been able to see that it's a lot easier for our participants to contact the IDT, and it's easier for the interdisciplinary team members to be calling the participants and get a face-to-face view of the participant. Another of the benefits is that participants report to us they have more connection to their local and their hometown communities. Like Dominic said, there's the radio app on the GrandPad, so they can listen, like in Washington, they can listen to King Radio or Como Radio, but they can also call GrandPad and say, can you get the radio station from like Dubuque, Iowa. And if a radio station in Dubuque, Iowa has a web presence, then they're able to load that onto the specific GrandPad. Our participants are able to go to church services, and they can go to their local church service, but it's the same thing. They can also go to a church service from their hometown if that church has a web presence. Our participants have been able, to watch sporting activities, and they've been able to order groceries right off the GrandPad because we have the Instacart as one of the apps on the GrandPad. Another benefit for the participants and actually for the Providence caregivers at Elder Place is the GrandPad customer service. Like BreAnna said, the customer service is open 24 hours a day, 7 days a week. Our participants can call at any time of the day or night. And I know for a fact, some of our participants who wake up in the middle of the night and they're feeling a little lonely, they might call GrandPad customer service just to say hello. And that's fine with GrandPad. I've never heard a complaint about that yet. But also on the staff end of things, I know for a fact, I mean, we've all spent countless numbers, probably like hundreds of hours trying to get our participants to be able to use their technology. So this is before we had widespread GrandPad use. You know, our participants had a really hard time getting on Zoom. They couldn't figure out FaceTime. You know, maybe they had an iPad, but they couldn't remember their password. And so it was just hour upon hour. And with the GrandPad customer service, any kind of technology questions, they can just call GrandPad, the customer service. They never rush a participant. They're always very kind. So that's been a really great benefit also. And the GrandPad has a built-in 4G LTE. So our participants don't need Wi-Fi. Our participants are come from a lower socioeconomic levels, and they just live in areas where they don't have good Wi-Fi. It's not anything that, you know, we agree with. You know, we wish the Wi-Fi service was better, but it is what it is. So having the GrandPads and having that reliable Wi-Fi service is really important, especially when you're doing a telehealth appointment or they're at a Zoom group. Before we had our GrandPad use, our participants would drop out of Zoom groups all the time, or when they had a video call with a provider, the Wi-Fi service would just stop. So having that reliable Wi-Fi service has just been a really wonderful benefit. And we've also seen a decrease in the cancellation of appointments. So before we had widespread GrandPad use, for a participant that became COVID positive, or if they lived in like a group home and the caregiver became positive, or the caregiver or another resident there was exposed to someone with COVID positive, then we would have to cancel their medical appointments. We couldn't let them come into the center. But with the more widespread use of the GrandPads, we are able to so easily convert an in-person appointment to a telehealth appointment. So a provider can call the participant right on the GrandPad. I know our psychiatrist in Washington just calls the participants right on the GrandPad, or we can convert the appointment to a Zoom appointment. And that's been a really great benefit as well. Next slide, please. One of the great things about working with the GrandPad company is that they're always looking for new uses, and we're also looking for new uses and how we can use the GrandPads more effectively. So some of the things that we're looking at for the future is Dominic and I have been looking at working with our on-call services. Our participants can call Elder Place at any time of the day or night. If we're closed, we have a on-call service. And so we're looking at ways to support our PCPs that are on call to be using the GrandPads. We're looking at starting more support groups on the GrandPads. We're also very excited that we're going to be able to increase our communication between our Elder Place caregivers and participants. We're working with GrandPad company to set up like a little website that would be available to our participants on the GrandPad. And we would be able to add announcements to that website, and we will be able to upload information about our program. So it would be kind of like a way almost of doing like a blast email, but it would just be on this website. Every month in Washington, we send out a newsletter to our participants, and we're very excited that we're going to be able to upload the newsletter onto the GrandPad. So participants will be able to get it, at the very first of the month. They won't be dependent on the U.S. Postal Service, which will be a really wonderful benefit. GrandPad is in the process actually right now of beta testing a vital signs program software. So participants will, open up their GrandPad, they will tap the vital signs app, and they'll be able to put their face in a little circle on the GrandPad and hold it up there for a certain amount of time. And we will be able to get some vital signs from that, which is really amazing. Right now with the GrandPad, we can do two-way calling. So we can call a participant can call us, but GrandPad is working on a way to have three-way calling. And that will be really great if a participant is in an appointment with the doctor and they want to have their family sit in, or the guardian wants to sit in. And it'll be a really great benefit also with our interpreter services. Our nurse case managers are looking at using GrandPad for symptom management and some end-of-life changes. Our internal and external schedulers are looking at ways to increase the calendar use. And I think Dominic mentioned this, and so did BreAnna, that GrandPad comes in many languages other than English. Just in February, when we had our deployment, we had a GrandPad that came in Mandarin and another one that came in Vietnamese. So when a participant opens up the GrandPad and they see all the GrandPad icons, instead of the label being in English, the label is in a language that they might understand. And another future use is that we can request through GrandPad specific languages that we would like them to try to start translating the GrandPad into. Most recently, we asked GrandPad if they could start looking into translating the GrandPad into the Amharic language, which is a language that many people in Ethiopia speak. And in Elder Place, Washington, we have quite a few people that speak that language. And so they're starting to do that. And then we're also looking at integrating the GrandPad with Epic a little bit more fully and using MyChart. And so those are some of the future uses that we are thinking about and working towards this year. I'd like to thank everybody for coming, and we'd love to answer any questions that you might have.
Thank you, Susan, Dominic, and BreAnna for the presentations. Are there any questions for the presenters? Susan, this is Chris Chong, the moderator. So is the GrandPad in a way like a cell phone, because you're using, so you're not dependent on Wi-Fi, but it's more like a phone service?
Right. Yeah, that's like the great thing about it, because like I said, our participants live in areas that do not have good Wi-Fi. So it is like a cell phone. So it has this built-in 4G LTE. So our participants don't need to be on Wi-Fi. It's all built into the GrandPad.
And it works. So then if they, a participant would get a GrandPad and maybe they had poor reception, we can check cell towers around them. And then we just issue them a different device with a different SIM card in it. So then they can get service in their area.
Very clever.
Mm-hmm.
Okay, there's one question. How do provider order this service?
Yep, so there's two different routes. So here on the screen, the consumer website. So that's if you have a loved one or someone in your family that you want to purchase a GrandPad for. But if you're interested in maybe for your organization and more of a business partnership, you can go to grandpad.biz, B-I-Z, and fill out a survey there. And then we can help answer your questions and discuss different use case models that might fit your needs.
Okay, I don't see any more questions. So I think we'd like to thank the presenters for a very interesting topic, because this really helps our elders connect. And this is really a great service to our community. So thank you.
Thank you.
Thank you.